Hey, I'm Dr. Jerry Williams with Urgent Care 24/7, here to talk to you today about a really common problem, sinusitis. It's amazing how many people we see in our Urgent Care 24/7 urgent care centers nationally who don't understand this illness. And I think that sinusitis, especially chronic sinusitis, is such a common problem because it's poorly understood. It can be very difficult to treat, but if you treat it right, treat it quickly, and treat it thoroughly, overwhelmingly, sinusitis resolves, meaning you get a complete cure. So let's talk a little bit about the sinuses and the anatomy of the sinuses. First of all, the sinuses are about total volume of your fist, and they're in your forehead and on either side of your nose, and back behind that are additional sinuses. And these are hollow cavities that moisten and warm the air that you breathe in through your nose, through your nerese, through your nostrils. And what's the problem is when you get infection in the sinuses, in these cavities, there's no blood vessels in the center of those cavities. So when you take an antibiotic, the antibiotic goes through the bloodstream to the exterior of your sinuses because they're highly vascular, but not into the center of the air cavity space where there can be infection. So you can't get antibiotics to the center of the infected sinus. And that's the problem. So it's kind of like an abscess. When a patient has an abscess, the first thing we do is we drain the abscess, then we give them antibiotics. If you don't drain the abscess, you're not going to achieve a cure because, again, there are no blood vessels in the center of a cavitated abscess. So it's critically important that you drain the sinuses. Now, the problem with the sinuses is they're bony and they're inside your face. So they're very difficult to access, although ear, nose, and throat physicians can use scopes and can fiber optic scopes and can go in and suction out the sinuses and help clean and irrigate them. But the key is what I just mentioned, is irrigation. And we emphasize self-irrigation of the sinuses, where these patients who present with sinusitis, we get them on an antibiotic, we give them steroids, but we also greatly encourage them doing sinus irrigation. And I don't mean just nasal spray. I don't mean just saline nasal spray. We actually encourage them to use a buffered distilled water saline that they can make up, and use I prefer the Neomed sinus rinse bottle, not a neti pot. And you take that Neomed sinus rinse bottle and you irrigate out the sinuses thoroughly. And what we found is in patients who utilize that sinus irrigation 2 or 3 times a day, along with their antibiotics, their sinusitis resolves much more quickly. And we almost never have those patients return with a chronic sinusitis or a relapse of sinusitis. In fact, I encourage patients who like to garden a lot or out in the yard, mowing grass, blowing leaves, that kind of thing, and especially also during heavy pollen periods during the spring, to use that Neomed sinus rinse bottle and to rinse out their sinuses. And you can actually prevent sinus infections by keeping that rinsed out and keeping it clean. It's been very effective for me. So again, sinusitis, common problem, but uncommonly understood. In fact, frequently misunderstood. So again, if you've got sinusitis, don't mess around with it. Go see your primary care practitioner as quickly as possible and get definitive treatment. But remember, the antibiotics are important, the steroids are important, but the sinus irrigation is critically important to wash out and keep the sinuses clean so you can get a full treatment of the infection of the sinuses. I'm Dr. Jerry Williams with the Urgent Care 24/7. Life is 24/7, and so are we.